A 32-year-old woman has just delivered her baby vaginally after an uncomplicated labor. The delivery went smoothly and the newborn is healthy. However, about 10 minutes after birth, the nurse notices that the mother is becoming unusually pale and fatigued. Blood is pooling rapidly beneath her, and the pad under her is soaked through. The patient reports feeling dizzy, weak, and lightheaded. She begins breathing faster, and her hands feel cold and clammy. Her vital signs show a rapid drop in blood pressure and a heart rate of 128, indicating she is going into early shock. On examination, the uterus feels soft, enlarged, and poorly contracted, a condition known as uterine atony, the most common cause of postpartum hemorrhage. Despite uterine massage, large amounts of bright red blood continue to flow. The estimated blood loss is already approaching 1,000 milliliters. The healthcare team moves quickly. Oxygen is given, two large-bore IV lines are placed, and aggressive IV fluids are started. Blood samples are drawn for cross-matching. At the same time, uterine massage is continued while the patient is given uterotonic medications such as oxytocin, misoprostol, or methylergometrine to help the uterus contract. A rapid bedside ultrasound reveals retained blood clots, but no obvious retained placental tissue. Because the bleeding is ongoing, the team performs manual uterine evacuation and continues uterotonics. If bleeding persists, additional treatments, such as carboprost, intrauterine balloon tamponade, or even surgery, may be necessary to control the hemorrhage and save her life. Postpartum hemorrhage occurs when the uterus fails to contract properly, leading to massive blood loss. Other causes include retained placenta, lacerations, uterine inversion, and coagulation disorders. But uterine atony remains the #1 cause. Thanks to rapid recognition and immediate intervention, this patient's bleeding begins to slow as her uterus responds to treatment. Her blood pressure stabilizes, and she is transferred to a monitored unit for ongoing care. Key takeaway: postpartum hemorrhage is a true obstetric emergency. A soft, boggy uterus with heavy bleeding shortly after delivery strongly suggests uterine atony. Early uterine massage, intravenous fluids, uterotonics, and rapid escalation are essential to prevent maternal death.